Did you know that there are two categories of infertility? This is important for you to understand. Many people believe that if they were able to get pregnant once, then they will be able to again. This is not necessarily true. Stay tuned and I will explain. Primary infertility describes people that are having difficulty becoming pregnant and have never been pregnant before. Secondary infertility describes people that are having trouble becoming pregnant, but they have been pregnant before. The previous pregnancy was often a successful delivery, or it might have been a miscarriage or even an ectopic pregnancy. You can further divide people with secondary infertility into those that also had trouble conceiving their first pregnancy and those who did not. This last category, people who had no trouble getting pregnant the first time, but now are having trouble conceiving again, is the one that causes the most anxiety from my patients. People have trouble wrapping their heads around the fact that they became pregnant so easily before and now are seemingly unable to get pregnant again. They will frequently say to me, "I don't get it," or "Nothing has changed." It is likely, however, that much has changed, but they just don't realize it. Some people with secondary infertility actually had fertility issues before, but they just got lucky and were able to conceive and deliver anyway. They are only now seeing the impact of those long-standing problems. It may also have been that the issues interfering with fertility in the past may have been milder and they became worse over time. One of those issues is aging. As we have talked about numerous times on this channel, people with ovaries will see their fertility decrease as they get older. In any given month, the chance for a 25-year-old to become pregnant is much higher than it is for a 35-year-old. This is usually a gradual decline for most, but there may be times when fertility declines more rapidly. Watch this episode for information about that. By definition, people with secondary infertility are always older than people with primary infertility. As a result, age-related infertility is going to be more common in people with secondary infertility. Another factor is weight. Fertility doctors look at weight in relation to height by using a number called BMI. People with a higher BMI have more trouble becoming and staying pregnant until delivery. Watch this video for more information about the impact of BMI on fertility. As people get older, they are more likely to become overweight. For example, the average BMI for a 20-year-old living in the US today is 27.1, which is considered overweight. The average BMI for a 35-year-old is 30.2, which is in the obese range. People with secondary infertility are therefore more likely to have issues with their weight when trying for a second pregnancy than they did during their first. Tubal blockage is a relatively common cause for infertility in both primary and secondary infertility. However, this study found tubal blockage in about 1 in 5 people with primary infertility, but in nearly 1 in 3 people for those with secondary infertility. The reasons why tubal blockage is more common are not clear. For instance, the rate of past infection with chlamydia, a bacteria known to cause tubal blockage, was the same in both groups in this study. There may be aspects of a pregnancy or a delivery that make it more likely for tubes to get blocked. This is the reason, for my patients, we will repeat an HSG after delivery before starting fertility treatment again. Finally, any of the problems which can cause primary infertility can also cause secondary infertility. Ovulation problems, for example, are the most common cause for primary infertility, but we still see ovulation problems commonly in people with secondary infertility. Because of the cumulative effect, secondary infertility is actually more common than primary infertility. For example, when I look at new patients who come to my office for infertility treatment, 40% have primary infertility, but 60% have secondary infertility. Our Infertility TV bottom line is this: infertility is a common problem today in the United States. Don't assume that because you were able to get pregnant easily the first time, that you will be able to get pregnant easily again. There are a number of problems that can arise or worsen, even though it seems to you that nothing has changed. Infertility TV is your most trusted source for accurate information on infertility and miscarriage. If you are not a subscriber yet, hit the subscribe button right now. A new episode is released every week. Don't miss any episodes. You can also check us out on our website, ivf1.com, where you can become a patient.